Welcome back to another episode of Down There with Liz. I'm your host, Liz from Lioness, and today we're talking to Dr. Karyn Eilber. She's a urologist whose specialty is female pelvic medicine and reconstructive surgery. We talk a bit about some of the research that she's been working on the health benefits of vibrator use, and then we also talk a bit about lube, including some of the lubricants that she's working on at her company, Glissant. Enjoy the episode. So I guess as a first thing for folks who are listening, folks who are watching, who are you? What do you do?
We can go all the way back how many number of years. So my name is Dr. Karyn Eilber. I am a urologist by trade, and I specialize in female pelvic medicine and reconstructive surgery, which sounds really impressive. But in summary, take care of basically the vagina and all the associated parts down there. So commonly treat conditions like prolapse, incontinence, and includes female sexual dysfunction, which is how we ended up here today.
Got it. So I guess taking a step back, what is urology? What does a urologist generally do?
It's a good question. I think traditionally people have viewed urologists as like the equivalent of a male gynecologist, but it's really not. So a urologist takes care of everything in the urinary tract, starting from the kidneys all the way to the bladder. So kidney stones, unfortunately, cancers of the urinary tract. And then within the specialty, there's pediatric urology. So kids that are born with congenital problems of their urinary tracts. And then also we do what is the equivalent of urogynecology. And that's what I do.
Got it. So how then is urogynecology different from typical gynecology?
Well, urogynecology, whether you are a urologist practicing it or a gynecologist, should be the same. But general gynecology is your pap smears, fibroids, birth control for the most part. But urogynecology really is focused on diseases of the pelvic floor. So again, incontinence, like when you lose bladder control, or prolapse when your organs are falling, and then things like female sexual dysfunction.
So then also, I'm going to bring in sexual medicine into this, and I'm familiar with the broad, sort of the broad brush strokes of what that field is, and maybe some people listening are too. How would that all kind of triangulate together in terms of how a urogynecologist overlaps with sexual medicine, or are they more distinctive? That sort of thing.
They all overlap somewhere. So it would be more of the, surgical aspect of sexual medicine and some of the hormone replacement for that. But I could never do what a sex therapist does. Or maybe someone who really specializes using in sexual medicine, specifically really difficult hormone replacement. So everybody kind of has a place. So sexual medicine, you're right, is a very broad term. It's if someone has recurrent kidney stones, the urologist would be the one to remove the stones, but then a nephrologist would be the one who medically manages the stones.
Got it. That's a new specialty for me. But
we got all sorts. We got all sorts of specialties for you.
Keep that in the back.
You got any ailment? We got 10 doctors for you.
Keep it in the back pocket in case I hope I never need that, but
hopefully not. But yeah, stones occur during pregnancy.
Oh, great. Oh, great.
You got my number.
That's very true. Okay, so we've kind of established what those fields are. How did you get to how did you become a urogynecologist?
How did you get involved in vibrators? Yeah.
Yeah, that sort of question.
Right.
It's more what got you excited to go into the field specifically?
So when you're a medical student, you rotate through all the different specialties and you kind of find your people, if you will. And initially I thought I wanted to do OBGYN, but then I realized that I really like my sleeping and not getting woken up in the middle of the night. So OB was kind of out. And then I was going to do maybe just gynecology. But then when I did my urology rotation, I just like all the different aspects of urology. I also like the fact that you take care of both men and women. So that's how I chose urology.
Got it. Okay. Yeah, that it makes sense for sure. So then part of how we ended up meeting originally was some of the research that you've been doing on vibrators, which is, I'm a little bit biased, but I think it's really cool. Yeah. I think it's really cool. I think the listeners will find it really cool too, because they're following, or a lot of them are following
Obviously
a vibrator.
That's why you're listening.
Yeah. Exactly. So like, I really wanted to talk a little bit about that too, in terms of like, what is this research that you all have been working on, like in terms of the gist of it.
So, to give a little background, how we ended up there was, so I'm very much a female health advocate, and I really think that women, I don't want to say disservice, but we haven't had necessarily all the same opportunities as, say, males have in medicine. And so, in urology, and this is where I like being urologist because you actually see kind of how both genders are treated. When a man removes his prostate for prostate cancer, it is very common that he has erectile dysfunction and also has problems controlling his bladder. In efforts to reduce that chance or the severity of those complications, men are actually started on medications like Viagra right after their surgery. And it's not that they're expected to have erections, but medications like Viagra increase blood flow. Right. And blood flow is what heals everything. That's how, like when you slam your thumb gets swollen because all the blood flow brings all the nutrients for the healing. And yet we do major pelvic surgery on women and we do nothing. And then when they recover from their surgery and they finally feel sexually, ready to move on a year or two later, things don't really work very well. Right. And there is something to the, use it or lose it. It's like anything. If you don't go to yoga class, you lose flexibility. If you're not sexually active, you actually lose some of your sexual function. So we thought, well, and in general, also medications like Viagra aren't tolerated as well by women because we're smaller and people get like really bad headaches and stuff. So they don't necessarily want to take it every day, and also probably would not be covered by insurance. So we started thinking, what could we do for the equivalent of that kind of, they call it penile rehabilitation in urology. How do we do vaginal rehabilitation, after surgery? So that's where we came up with, how do you increase blood flow? Well, arousal. And what's an easy way to do that? Use a vibrator.
Got it. So basically what is the study that you've been working on?
So vibratory medicine is actually not new. It's been around for a while. And in fact, for hysteria, which, just FYI, it's called hysterectomy, not uterusectomy, because they thought that removing the uterus took out the hysteria from a woman. So that's a whole other conversation. Anyway, so
classic.
Physicians used to manually stimulate women, and it became obviously very physically difficult. So they actually had like what would be the equivalent of a medical vibrator like a long time ago. Obviously the technology wasn't quite there. And then somewhere along the line, these devices got associated more with pornography. And that's when they got a more negative stigma than something that is, for regular use and that shouldn't be looked upon with shame. And so, I totally got distracted with the question.
The history of the vibrators.
The history of the vibrators, yes. So, actually, so the vibratory medicine, and we thought, okay, well, if we're going to do this kind of rehabilitation, we don't really know what it could help. And so a lot of common conditions that we see are either like lack of arousal because a woman can't, get wet on her own very well, or chronic pain, or incontinence, right? Because we tell women to do your Kegel exercises. Well, if you're doing, using a vibrator, that's also stimulating the pelvic muscles to work. So we actually are having women with lots of different, what we call pelvic floor disorders. And those are the, pain with intercourse, incontinence, all these different ones. Mm-hmm. And we're having them use a vibrator regularly. We do baseline questionnaires to see what their function is. And then over time, we see which conditions improve.
Got it. And you've presented this at a few different conferences. I was at the one at Ishwish, and I saw it was a few months ago, so my memory's a little bit rusty, but I did see that. And you've presented it at a few other conferences also, which has been awesome.
Yeah. I mean, we presented the background why we did it. We don't have any of the data yet because we're still collecting it. But what's really been exciting is almost every meeting, and even like within our own institution, has been very receptive to it, which makes me happy on several levels. One is that, they see that actually women's sexual wellness is important. And that number two, they're helping to destigmatize things like vibrators.
Yeah, because also like I think I remember a bit of this from the presentation and also just some of my own, or what I know of the area so far. But like there's been some talk about masturbation being good for you, kind of broadly, like maybe vibrators being good in some way, but like what previous research has been out there before this or before what you're working on?
Well, I don't think there is any debate in research that like orgasm is good, right? Because it releases endorphins. I mean, it's just a way of people releasing like a lot of their stress. But in terms of, like specifically for vibrator use, very limited studies. And they were typically very small numbers. Some of them did show improvement in pain with intercourse, improvements in incontinence, but nothing that is on a large scale and that was really kind of controlled and had like baseline information and then following them over time with a kind of set schedule, if you will, of how to use the vibrator.
Got it. Why do you think that is? That there hasn't been as much research on like looking at the benefits of vibrators.
Why was Roe v. Wade overturned? I mean, yeah, we're not going to go into politics, but I just think, I think it takes time in any society to change their views. I mean, look, it was just in the 60s and 70s when like there was sexual freedom and birth control. I mean, it seems like so long ago, but yet it takes a lot of time, I think, for people to change perceptions. And so I think for most people, when you say the word vibrator, it kind of snickers a little bit, you know? So I do think it's time. And you also need people who are interested in doing this. And, you know, sexual wellness and sexual health also, like the meeting you went to, these societies are all relatively new. So it's just things where people are finally getting together and getting organized and doing research for it. You know, there's a time for everything. And I just think now is the time people are open-minded. I mean, we've got so many things going on. You know, we've got same-sex marriages, transgender. I just think it's a different attitude for everybody all around.
Yeah, no, that makes sense. Like, I mean, I know of some of it that I'm asking. It's partly like, I mean, yeah, even with like looking classic example of like Masters and Johnson and like looking at from what I remember from like the history of it, of the struggle of like them being able to publish papers. Right. And that was like in the, you know, like even in like the 1980s when they were still doing some of that, and him risking losing his medical license and things like that.
I just think it is unfortunately human nature that anything that is different and not mainstream is always looked upon with, and it should be, we should all scrutinize anything that's new to make sure that we're not having the wool pulled over our eyes. But, you know, again, for the most part, I was really pleasantly surprised. So one of the places that we presented research was the American Urological Association, which traditionally 90+% of urologists are males. So the fact that they had, you know, our vibrator research featured even in the media section was a big deal.
Right. Yeah, because that's a pretty significant conference too.
And you got to figure it's mostly males, so it's actually great that they actually care about female sexual health.
Right. In preparation for your study, what have you been finding so far about association between vibrators and benefits for people?
So we haven't totally analyzed the data, but I'll tell you one thing that we have found is that women are interested all over. So at our meeting, the American Urological Association was presented at, because it was in the media section, it got dispersed, you know, nationwide. And we got emails from women all over the country. I'm 63 years old. I have this issue. I'm 73. I'm 47. I'm 27. And I think that women are really waiting for that opportunity where they actually have someone who is, you know, I think in general, people trust physicians, right? And they look at them with some type of, you know, authority of things. And so when you have someone who's saying, hey, it's normal to use a vibrator, and not just that, but like your doctor is saying maybe it's good for conditions, that I think that's one thing also. It makes me feel really good. I feel like we're making a difference for women and kind of opening the door for that conversation. But that was one thing that we were really surprised about. It's like just how many women were just reaching out and totally open about the fact that like, I want to be in your study. I want to do this. And unfortunately, we're not open to, you know, anyone outside of California, but it's really, it's been really a great experience just to hear from these women all over the place.
Are you still open to people inside California?
We are. The only disclaimer is you do have to actually have a physical exam. So, and we can do it in one visit, but you do have to actually come to Los Angeles.
Got it. So, okay. Like ideally LA area, but
although people come to LA for work all the time. So like if you happen to be here, we'll try it. You know, we have made it happen for a couple of people. But yeah, you got to hurry because we don't have that many spots left. I think we're actually almost closing recruitment.
Ooh, okay. We're going to have to publish this one soon. So another thing I wanted to to touch on a little bit is tell me how to like sort of phrase it if I'm not phrasing it in the right way, but the approach to conducting the study, because I remember reading in from Cedars-Sinai.
Mm-hmm.
I'm saying that correctly.
Yeah.
Okay. Yeah, from Cedars-Sinai. There was something that was about how you're approaching it is similar to how like treatments for men and people with penises are, I guess, evaluated, or how.
Oh, yeah, that was actually what we were talking about earlier with the penile rehabilitation, how the men right after prostate surgery are treated with those medications, like to help increase the blood flow and help healing. And so that's where we're kind of going with this is, if we know a woman is just having pelvic surgery, can we give her a vibrator early on to hopefully maintain her sexual function so that, a lot of women who have surgery, whether it's for, uterine cancer, breast cancer, different things, you just don't really feel that sexy for a while, and you're also just really worried about surviving your cancer. So before you know it, a long period of time passes. And especially for a woman who, you could be, unfortunately, 30 years old, be treated for breast cancer with all these treatments that basically put you into menopause. So if you're put in menopause early, you don't have sex for a long time, and you try to have sex, and it hurts because you don't lubricate, your tissues are no longer stretchy because you've been lacking estrogen. That's what we're trying to avoid, because if we say, hey, you know what, you're having your breast cancer treatment or you're having your uterus or ovaries removed, start using your vibrator as soon as you feel up to it after surgery so you can keep that blood flow going and help maintain your sexual function.
Got it. So I think what I was trying to ask, just to kind of rephrase it for people, especially for people who are listening, basically, like the approach of the study is that you're using vibrators you're using vibrators as a sort of treatment in a way, or
potentially, yes. It could be as treatment, could be as prevention, right? So let's say that you had surgery and we think you might be at risk for having pain with intercourse later. We'd have you use a vibrator as prevention. Let's say you already have pain with intercourse, then that might be your treatment for it.
Got it.
We're trying to make it a miracle device.
What Viagra is, basically.
Right.
But yeah. So yeah, it's like you have people with these different conditions, and then you have this miracle, this treatment, this preventative measure of some sort, and then you're able to measure different outcomes from it.
Absolutely. And, we use miracle a little bit jokingly, but at least there is something. I mean, right now, we don't really offer women much for a lot of things.
Right.
Or even if it's just education. So let's say if a woman has her own vibrator and shows she has one of these conditions, she can just keep using it. I think at this point in time, a woman might think, well, gee, I can't use it because I might actually harm myself or make myself worse.
Right. Well, that's a topic I would...
But if you just had surgery, you're going to be hesitant about doing anything. Right?
Yeah.
I mean, if you're obviously nothing is different, but I mean, I take care of a lot of patients, and, it's kind of like if you've ever had cancer, even if you have a runny nose, you're worried your cancer came back, right? So if you had surgery down there, you're going to be worried about anything that goes down there, whether it's a soap, a vibrator, anything.
Yeah, no, that makes a lot of sense. So yeah, being able to have data to show like these are some of the outcomes.
Right. At least being able to Google and say, is it okay for me to use my vibrator after a hysterectomy?
Yeah, and having data as opposed to my mom's friend said it was okay. So
there's always those one-offs. Yeah, my mom died using a vibrator, so I know they're dangerous.
Oh, geez, yeah. That's Which
that would be episode 2.
Crazy stories with vibrators.
Right.
Oh no. Yeah, that's...
That actually would be a really good podcast, right? Send us your craziest vibrator story.
I'm, afraid, but a little bit curious.
You better have a lot of battery in your camera.
Yes. Okay, so I mean, this is, all great in terms of like what y'all have done, what's been presented, what's happening next?
So we're going to finish recruiting for the study. And then once we're done, we'll actually analyze all the data. And ideally, when we separate it out, we'll have enough people in each group to say, oh, you know what? Vibrators are great for treating this condition. Oh, you know what? Not so great for this. Oh, we're surprised it actually helps with this. And then we can actually focus on those different areas. So right now it's a little bit of kind of casting your net wide and seeing what you catch. And then we can kind of go from there. Other studies that we're doing are, we're also conducting focus groups to see like, what do women even know about like what sexual health really is? A lot of this attention now goes to, what is healthy sex? How do you say no? Like, how do you empower yourself? And so I think, in general, education is power. So if we can find out, like, we don't even really know, like, what is baseline sexual education for women. I am a strong believer that we are not educating young women enough. We have a health class in junior high, and then you're kind of left to asking your friends and like your mom if she's open enough to even talk to you about it.
Or internet.
Right. Or even if they have accurate information. And so like, if you really had a question about sex, first of all, I think a lot of women, unfortunately, are probably just too embarrassed to ask. But secondly, who do you ask? And most doctors don't treat sexual function. And even like a general urologist or general gynecologist who doesn't specialize in these things may not even know the right answer. So I think women are put in a very difficult position of not having the education to begin with, and then not really having a reliable resource to get more information from.
Right. And I guess also going to, or you can answer this or not, but going to the, like, what's next for the study, like something I'm curious about is there a question of like looking at different types of like vibrations or sensations or locations? Yeah.
Yes.
Yeah.
Well, so that would be one of the things, right? So let's say, for instance, we see that women who have problems controlling their bladder or have pain with intercourse definitely see improvement with a vibrator. Okay, well then what is the best schedule, if you will, right? What are the best settings? Because we don't even know, like right now, like if you were to go and buy a vibrator and you say, this is my problem, like who can really tell you which one to buy?
No one.
Exactly. So yes, absolutely. It would be more of, okay, great. Now we know that the vibrators can help, but how do you make it even better?
Right. Okay. I'm glad that's on the list, because
on our to-do list, which is like really long.
Yeah. I can only imagine. There's so many different types of vibrators. So I'm like,
yeah, but what's really fun for me is like, I'm old now, and it's fun to, you've met some of the younger people that I work with. It's just really exciting to see like, who's going to pass the torch.
It's true. Yeah. So
I will never be able to get half the stuff done in my lifetime that I want to get done, but all I can do is inspire people to keep going with it. And it's really, I think women really like to help other women. And so when it gets started, I don't think it'll be a problem to find people to just keep going with it.
That is true. Yeah. Like, I was just thinking before, like literally handing the wand.
Yeah.
The magic wand.
Right. Not pass the torch, but pass the right.
Yeah. You can literally just pass the vibrators, the different ones.
That's a really good ad.
It's like, we want you to do vibrator studies.
Yeah. We are passing the wand.
Oh, I'm already designing it in my head. I'm like, I need
this podcast is over the top already.
But yeah, no, it's really great to hear in terms of like, what you're looking at doing next, and just the potential of this study and all the different studies that come after it.
I think it's really cool. I think anything that is, but this is what's so interesting. Like, nobody would think it's weird if a guy said, I take Viagra, because it's so common. And you go to the pharmacy, you get it filled. Like, I'm pretty sure you wouldn't be sitting around like a lunch table these days and go, yeah, I used my vibrator last night. Like, people would still kind of raise an eyebrow. Not that they didn't use their own, but you just don't talk about it.
Right. I could think of several places on the internet where people will be like, bruh, like, talk about using Viagra.
Right.
but yeah, no, point taken. It's such a mainstream thing, and has been such a mainstream thing. So that makes sense.
But the fact, though, that if a man has erectile dysfunction, they already know right away, like, you go take your medication for it. If a woman is having difficulties with orgasm or different things, I don't know how many women's minds it would cross to potentially try a vibrator, right? I think for the most part, you probably just kind of suffer.
Yeah.
or just try to just, manually masturbate, do something else. And, I also just think it's like, why can't you just go to the drugstore and buy a vibrator like you would like anything else?
Yeah. Yeah. It's a big problem.
Soon.
But yeah.
Soon.
Getting there. So, okay, so is there anything else that you want to, or let me think of a better sort of like kind of going more broadly, because you're working on this research, you're a practicing doctor, like you also have other sort of projects that or other sort of like things that you're working on. So I wanted to also mention that too.
Yeah, which is indirectly actually how we also met. So after being in practice for, now it's like 20 years, but probably about 15 years into practice, literally every day I would hear a woman say, I'm not sexually active because I'm too dry and I can't find a good lubricant. And you start looking at the ingredients, the lubricants that were available. And, there's a lot of push for like clean beauty, right? Because we don't want to be putting chemicals and stuff on our skin. And yet most lubricants contain the same things that most beauty products proudly advertise they don't contain. And yet we're putting that stuff in our vagina. So one of my friends who is in the beauty industry, we decided we are going to make our own lubricants. And so that's why we started the company called Glissant that are natural, and I'm very proud to say we have FDA clearance for one of them.
Oh, awesome.
The other one we don't, because that's CBD, and the FDA doesn't recognize CBD. But in doing that, that's how kind of opened up more to the whole like field of like sexual medicine and how can I say, underserved women are when it comes to it. And then also that brought in the use of looking into more of the needs. And that's where vibrators came in, and how we started doing the study, and then how we ended up connecting with Lioness.
Oh, man. Yeah, that's... Yay.
All roads lead to vibrators.
They do. So yeah, no, that's awesome. Cause yeah, I could do a whole episode on lubes. I have so many questions about lubricants, and like, what's the TLDR with lube? And yeah, the TLDR from your perspective.
So it's funny because lube almost has the same negative connotation as vibrators do for a lot of people, right? There is stigma. Like a big misconception is you only use lube because you're dry. Actually, the great majority of people who use lubricants use it just for pleasure, not because they necessarily have dryness or really need it. Mm-hmm. And the other thing that is interesting is a lot of people's partners assume they're not turned on. That's why they need a lube. And people don't realize that there are actual physical reasons that a woman cannot get wet.
Right.
So yeah, lubes it's so interesting. Like I would say that most even gynecologists and urologists don't even really know how we naturally lubricate, like what it really is. And one important thing, everyone talks about pH balance, whatnot. The vagina is actually very acidic. And most lubricants are not pH balanced for the vagina. And that's why a lot of women would come back and tell me, I used this lube, I felt worse afterwards, I feel like I get a vaginal infection every time I take one. Mm-hmm. Yeah, because some of it have things like glycerin, which are like sugars, which theoretically promote like yeast infections. But also when they're not pH balanced, they cause like an imbalance of your own organisms that just cause you to feel irritated or get infections.
Right. So yeah, your products don't do that.
Right. Well, yes. So especially because, it's not like, again, nothing is a miracle. There are some women, no matter what they do, they're prone to infections. But yes, it is meant to be pH balanced to not cause an imbalance of a woman's own bacteria. And also, things like hyaluronic acid, which we know are great moisturizers. It's also naturally acidic. Believe it or not, our own bodies actually make lactic acid. That's what keeps us acidic. And so it's got all these natural ingredients that keep it naturally acidic, which is what our vagina should be. So we always like to say it's like, a lube that is actually good for your vagina.
Yeah, I do like that. I'm like, yeah,
it's also reusable packaging. So the outside is, I don't even know if I have.
You want to grab it? Or?
Yeah, we can show it. Yeah. So I think it's sealed up.
Okay.
But I can the inner chamber is refillable. And so you can also have sex and save the planet.
If you need any more reasons to have sex. Here's another reason. Right. But yeah, I think that's cool since, like, from my very general layman's understanding of the, like, FDA process on lubricants, it sounds like it's a little bit outdated.
Well, so technically, lubricants are a medical device.
Right. It's like a type 2?
Correct. A class 2 medical device. So theoretically, lubes should all have FDA clearance, but there's not really a lot of strict enforcement of that. So that's why there's a lot of lubes that are out there. Or I think that if you just don't say it's a lubricant, that's why you'll see things today like intimate moisturizers, different things. But yeah, the FDA process is, I mean, I think it's good, obviously, because then you can...
It's something, yeah.
Right, you're at least rest assured that it's gone through a certain amount of testing for that. But yeah, who knew? Lubricants, medical device.
Yeah, and meanwhile, vibrators, not.
I know, which I guess is good if you're manufacturing them, but it's just, on the consumer side, you're like, how can an actual device not be a device, but a liquid is a device?
Yeah. Yeah, it's don't even get me started on that. I'm just like, it's such a bizarre distinction. I think the last thing, just to sort of like wrap it up, is if you want to mention anything else that you're working on, anything else in general, and then where can people find you in terms of like website, social media, that sort of thing.
So currently what we're working on is, again, just trying to get these focus groups together, really trying to find out like what women actually know at baseline, what they would like to know. We're trying to see if like some type of intervention, like an app, can really help with women's sexual education and knowledge about their sexual health. I am a physician at Cedars-Sinai. If you're in town, can take care of any of your vaginal needs. And on social media, I'm at Dr. Eilber, Dreilber. And then the lube is Glissant, Glissant, which is French for slippery.
Nice. And that's is that the website also?
Just the website is glissantlove.com, and then the Instagram handle is at glissantlove.
Awesome. So that's where you can find
That's right.
all the good things.
Water-based lubes, compatible with all of your other toys.
Very, very important.
It actually is, unless you want that goopy kind of feeling.
Yeah. Oh my gosh. That's a separate conversation.
Yeah.
Like, we have some customer service stories, but
yeah. I bet.
But yeah. So, Dr. Eilber, it's been lovely talking to you.
It was so much fun. I mean, as you can see, I will talk about this, like anything that has to do with women's sexual health and their wellness, I will talk about forever.
Amazing. Yeah, we'll do this again. Hopefully I'll have a fancier setup.
We'll do our crazy vibrator stories.
Oh, yes. Oh my gosh. Yeah, especially after your study. It's like, let me tell you,
I slipped on my lube and my vibrator poked me in the head.
Oh, no. Yeah, we'll
exchange stories. Yes. That'll be over a drink.
Yes.
When you're done having your baby.
Yes. All right.
Thank you so much. Yeah. So fun.
Thanks so much for listening. If you enjoyed this episode, leave a like or a rating. And if you want to hear more episodes like this, hit that subscribe button. We publish these bi-weekly on every second and fourth Sunday. Until next time, stay curious.